Have you ever wondered how hypothyroidism, an underactive thyroid condition, gets treated? Hypothyroidism, a common yet often overlooked health condition, affects millions of people worldwide. It's a disorder where the thyroid gland doesn't produce enough thyroid hormone, leading to a variety of symptoms like fatigue, weight gain, and depression. These symptoms can severely impact a person's quality of life, making it crucial to understand the treatment guidelines for this condition. The prevalence of hypothyroidism underscores the importance of familiarizing ourselves with its treatment strategies. Whether you're a healthcare provider, a caregiver, or someone interested in the medical field, understanding these guidelines can prove invaluable. In this video, we'll explore the different facets of managing hypothyroidism, from diagnosis to hormone replacement therapy, lifestyle modifications, and the importance of regular follow-ups. We'll also summarize the key points to remember when treating this disorder. So buckle up as we delve into the world of hypothyroidism treatment guidelines. The first crucial step in treating hypothyroidism is, of course, identifying the condition. So how exactly do we diagnose hypothyroidism? Well, it typically starts with recognizing the symptoms. These may include fatigue, increased sensitivity to cold, constipation, dry skin, weight gain, puffy face, hoarseness, muscle weakness, elevated blood cholesterol levels, muscle aches, tenderness and stiffness, and even depression. In women, heavy or irregular menstrual periods and fertility issues may also be a sign of hypothyroidism. But it's important to remember that these symptoms are often generalized and can be attributed to various other conditions. Hence, we can't solely rely on symptoms to diagnose hypothyroidism. This is where blood tests come into play, serving as a more definitive tool for diagnosis. The most common blood test is the TSH, or thyroid stimulating hormone test. This test measures the amount of TSH in the blood, which is produced by the pituitary gland, and stimulates the thyroid to produce hormones. If TSH levels are high, it's usually a sign that the body is trying to stimulate the underactive thyroid to produce more hormones, thus indicating hypothyroidism. Next, we have the T4 or thyroxine test. T4 is one of the hormones directly produced by the thyroid gland. If T4 levels are low, it's yet another indicator of hypothyroidism. Lastly, there's the T3 test. T3 is another hormone produced by the thyroid gland, and while it's usually not the first line of testing, it can be useful when TSH and T4 tests don't provide a clear picture. These tests, along with a comprehensive review of symptoms and medical history, help doctors make a confident diagnosis of hypothyroidism. It's important to note that these tests should be interpreted carefully, considering factors such as age, sex, and overall health, as normal thyroid hormone levels can vary from person to person. Once a diagnosis is confirmed, we can then proceed to the treatment phase. The frontline treatment for hypothyroidism is hormone replacement therapy. This therapy is designed to compensate for the underproduction of thyroid hormones within the body. But how does it work? Well, it's all about balance. Our bodies need the right amount of thyroid hormones to regulate metabolism and keep everything running smoothly. The most commonly used medication for this therapy is levothyroxine, a synthetic form of the hormone thyroxine. When ingested, levothyroxine acts just like the thyroxine your thyroid would naturally produce. It helps to restore normal hormone levels, reversing the signs and symptoms of hypothyroidism. However, it's not as simple as taking a standard dose. Each person's body is unique, and the amount of levothyroxine needed can vary significantly from person to person. Factors such as age, weight, the severity of hypothyroidism, and other health conditions can all influence the appropriate dosage. It's a delicate balance to strike, and that's where individualized dosage comes into play. Individualized dosage is all about finding the right amount of levothyroxine for each person. It's a process that requires careful monitoring and fine-tuning to ensure that hormone levels are kept within the desired range. Too much or too little can lead to complications, so it's crucial to get it right. Regular monitoring of thyroid function is also an essential part of hormone replacement therapy. It involves periodic blood tests to check the levels of thyroid-stimulating hormone, or TSH, in your body. These tests help to determine whether your dosage needs to be adjusted. If the levels are too high, it may mean that you're not getting enough levothyroxine. If they're too low, you might be getting too much. Hormone replacement therapy is not a one-size-fits-all solution. It's a tailored approach, designed to meet the individual needs of each person living with hypothyroidism. It's a journey, and like any journey, it requires regular check-ins and adjustments along the way. Remember, the goal of hormone replacement therapy is to mimic the natural function of the thyroid gland. Along with medication, Lifestyle modifications play a significant role in managing hypothyroidism. Let's delve into some of these changes that can complement your treatment plan and potentially enhance your overall health. Firstly, maintaining a balanced diet is essential. It's important to include foods that are rich in iodine, selenium, and zinc, minerals that support thyroid health. Foods like seaweed, eggs, and nuts can be beneficial. At the same time, it's equally important to avoid foods that can interfere with thyroid function. Certain foods, such as soy, can inhibit the body's ability to absorb thyroid medication, so it's best to be mindful of your consumption of these foods. Regular exercise is another cornerstone of managing hypothyroidism. Physical activity boosts energy levels, combats fatigue, and aids in weight management, all common challenges faced by those living with hypothyroidism. It doesn't have to be anything strenuous. Even a brisk walk for 30 minutes a day can make a significant difference. Adequate sleep is also crucial. Hypothyroidism can often lead to fatigue and sluggishness. Ensuring you get a good night's sleep can help combat these symptoms and improve your overall well-being. Establish a regular sleep routine and try to create a sleep-friendly environment. Dark, quiet, and cool can be ideal conditions for a restful slumber. Stress management should also be a part of your lifestyle changes. Chronic stress can exacerbate hypothyroid symptoms and can interfere with your body's ability to absorb thyroid medication. Incorporating stress-reducing activities, like yoga or meditation, into your routine can assist in managing your stress levels and potentially improve your thyroid health. Lastly, it's important to remember that everyone's body is different. What works for one person may not work for another. It's always best to consult with your healthcare provider before making any significant changes to your diet or exercise regimen. Implementing these lifestyle changes can greatly enhance the efficacy of the medical treatment. Remember, managing hypothyroidism is not just about treating the symptoms, but also about improving your overall quality of life. The journey of hypothyroidism treatment does not end with just medication and lifestyle changes. In fact, this journey is a continuum that requires regular follow-ups to ensure the efficacy of the treatment plan. This is a key step that should not be overlooked, as it plays a significant role in achieving optimal health outcomes for patients with hypothyroidism. Regular follow-ups provide a platform to monitor thyroid function and adjust treatment if necessary. Remember, the goal is not just to normalize hormone levels, but also to alleviate symptoms and improve quality of life. Just like a gardener who frequently checks on his plants, adjusting the amount of water or sunlight they receive based on their growth, so too must we adjust the treatment plan based on the patient's response. This is not a one-size-fits-all condition. Each patient reacts differently to treatment, and what works for one may not work for another. Hence, it's critical that the treatment plan is individualized and adjusted according to the patient's progress. The importance of regular follow-ups is further underscored by the potential complications if hypothyroidism is left untreated or improperly managed. These complications can range from heart problems, such as heart disease and heart failure, to mental health issues, like depression and slowed mental functioning. In severe cases, it can even lead to myxedema coma, a life-threatening condition that requires immediate medical attention. In addition to these health risks, untreated or improperly managed hypothyroidism can also affect a woman's ability to conceive, and if she is already pregnant, it can have harmful effects on the developing baby. Therefore, regular follow-ups should be seen as an essential part of the treatment journey, not an optional extra. They allow healthcare professionals to stay on top of the patient's condition, manage it effectively, and prevent it from escalating into something more dangerous. Regular follow-ups ensure that the treatment remains effective and patients can lead a normal, healthy life. While the journey may be long and sometimes challenging, with regular monitoring and adjustments, it's a journey that can be successfully navigated, leading to a destination of better health and well-being. Now, let's quickly recap the important points we covered today. First and foremost, the diagnosis of hypothyroidism is crucial. It involves thorough clinical evaluation, blood tests to measure thyroid hormone levels, and possibly imaging studies. Once confirmed, the cornerstone of treatment is hormone replacement therapy. Levothyroxine is typically the drug of choice, administered to restore normal thyroid hormone levels, and thus alleviate symptoms. Next, lifestyle modifications can significantly support the treatment process. A balanced diet rich in iodine and selenium, regular exercise, adequate sleep, and stress management techniques can all contribute to better thyroid health. Finally, regular follow-ups are essential to monitor thyroid function and adjust treatment as necessary. These checkups also provide an opportunity to address any concerns or side effects related to the treatment. And that's a wrap on the guidelines for treating hypothyroidism. Stay informed, stay healthy. Be sure to like and subscribe for similar content released weekly.